Hi, this is Curtis Alexander. I'm a pharmacist. In today's video, what I want to talk about is a drug called Aubagio. This is part of our 101 series where we're just giving a big overview of your main points that you're going to see with some of these medications that your doctor could be talking to you about. Real quick before we get going, thumbs up would be appreciated. Hit that thumb button down there if you enjoyed the video. Also subscribe if you want to see more videos like this. So Aubagio, what is it for? It's for multiple sclerosis. From this point forward, because it's tough to say, I'm just going to say MS. There's different subsets of MS. There's relapse, remitting, clinically isolated, active, secondary. Aubagio can be used in all of those. As far as how it works in the body, we have a decent idea of how it works. Because it's actually an active metabolite of Arava, and I'll touch on that in a second. But what we do know is it blocks pyrimidine synthesis, and that's obviously a chemical process in your body. But the end result that we see is there's a decrease in inflammation, and we think it may decrease some of the lymphocyte numbers that we see in the brain and the central nervous system. So that's kind of the end result. Now, I touched on Aubagio isn't really quote unquote new. There's a drug out there called Arava, which the generic is leflunomide, and I've made a video about leflunomide if you want to watch that, but it's primarily used in rheumatoid arthritis. But when you give somebody leflunomide in the body, it's broken down. It's metabolized to Aubagio. The generic is teriflunomide. So we understand a lot about the possible side effects. They're very similar, obviously, so some of the side effects and so forth mimic that. As far as dosing, it's available in a 7 and a 14 milligram strength, just dosed once a day, so the dosing is very favorable for it. Side effects can be problematic. They're not terrible, but a few things you want to keep an eye out for. One, they'll monitor this with your labs, but it's hypophosphatemia, so you see your phosphate levels go down. We can see headache in 16 to 18% of people, and again, these numbers are possibilities. That doesn't mean if I give this to 100 people, we're definitely going to have 18%. It just can be up to that number, so I don't want to freak people out. You can see increases in serum alanine aminotransferase, another thing that they'll measure with your labs. You can see diarrhea, 13 to 14% of people, and an important one, particularly for women, not that hair loss isn't a big deal for guys, but women, they can get on medications and experience a little bit of hair loss. It's problematic, and that's when you want to know about. Interestingly, it's also a big side effect of leflunomide. So again, this can be problematic, especially for women. But again, we're in a disease state where we may not have the option to be picky about it. It's just an unfortunate side effect. A lot of people ask about weight loss. Can it happen? It can, primarily because one of the side effects we see again is diarrhea in these folks. So loss of appetite, diarrhea, that can happen. Interactions with Aubagio, I would have to give kind of a blanket statement that it really depends on what you're on. That's really up to the pharmacy you're going to and your doctor. But there can be drug interactions, but it kind of has to be something that's looked at individually for you. Definitely something you want to look at with Aubagio. As far as monitoring, it is something that they're going to need to monitor closely before you start it and while you're on it. As far as before, they're going to test you for tuberculosis, which sounds like something nobody gets anymore, but because we can see a drop in inflammation is part of that immune system. It's a good part of your immune system, but when we decrease that, we can see some immune system problems. So they're going to measure, test, see if you have TB. The usual test that we use is quantiferon. They'll just draw your blood, and in 3 days you've got the results. So we have the immune system concerns. Those are things they'll watch for. They'll test for tuberculosis. While you're on it, they're going to get a CBC in your first 6 months, or basically a complete blood blood count, everything. It's kind of a common blood test, but they'll monitor that. And they're also going to keep a close eye on your liver function test, because it can be tough on people's livers, which brings me to a point that, do we want to give it to people with liver issues? No, but MS is one of those diseases where we want to treat it particularly early on, and depending on the type, we want to treat it aggressively early on. So I think we've touched on all the high points of Aubagio. Any questions, post them in the comments. Again, thumbs up is appreciated. Subscribe if you want to see more videos like this. And again, comment below if you have any feedback on Aubagio. Personally, I'd appreciate it. So again, Curtis Alexander, thank you for watching.